Hey, Julie McCoy, host of the Humanity Unchained podcast with Jeff Joyce. And today we have a special episode for you all that I can't wait to share. We got to sit down and record with somebody who's pretty amazing, works in the healthcare industry. His name is Michael Stone, and I'll let you hear straight from him in the coming episode. Hey there, welcome back to Humanity Unchained. This is your host, Julie McCoy, and I'm here with my co-host,
Jeff Joyce.
And we are joined today by somebody who's pretty amazing. I'll let him introduce himself. We met him at the Innovation Series over at the Venture Cafe in Phoenix last week, and he's in an amazing industry doing some amazing things. So, Michael Stone, I'll hand it over to you. Tell us what you're doing.
Sure. Thanks for having me on. My name's Mike Stone. I'm a 20-plus year veteran of IT stuff. Have worked with virtualization, storage, tons of server operations, small scale. Now I'm in big scale, and I'm working with a group on the East Coast that runs 3 major hospitals, some of the top 10 in the U.S., a university, clinical research operations, all sorts of stuff. Basically, IT and healthcare in the medium scale IT healthcare space. We're not as big as something like one of the hospital groups here, which runs hundreds of hospitals, but we do a lot. So
over 20,000 employees.
Yes, 20,000 employees, lots of stuff. And I've been in investigating and playing around with some of the AI stuff for the past 2 years right now. I hit AI 4 last year, which they had a healthcare track on a bunch of the stuff that was going on in the healthcare space, as well as DEF CON. I've been in server work for quite a while, so IT and security is a big deal to me. And I'm already scheduled for AI 4 again coming up.
I love it. So you're an AI nerd.
Yes.
And a senior at what you do. So can you tell us a little bit about just some of the conversations we were having at the Venture Cafe, which I thought was interesting. We went out for pizza with Mike afterwards. Good times. But you were talking about the problems of AI application in healthcare and the reason behind getting one of the new Nvidia chips delivered recently, and you're helping set up the custom LLMs. Talk through that. Like, what are the challenges you see with AI in healthcare?
Sure. So the issues that we have with a lot of the stuff with AI in healthcare right now is the hallucination problem. There's, and this is true in a lot of spaces, there's a lot of talk about what AI could do that doesn't really match what it currently can do. There's a lot of pie in the sky dreams about what you can use an AI model for. And when it comes down to the reality of it, when people start looking at the hallucination problem, some of those dreams start to fall apart. And especially in healthcare, that's an issue. Like, we have talked about things like using AI to check somebody's records after they go visit a doctor and give them a second opinion. And it's like, okay, that makes good sense. It sounds like it would be a great idea for an AI. But the problem becomes, what if it hallucinates? Mm-hmm. What if it doesn't look at something and say, hey, you're fine, the doctor's right, you just have a mild flu? And what if it comes up with something completely out of left field and says, you have stage 1 cancer? Oh. It suddenly becomes an extreme problem, as well as something that, that will scare the crap out of people if they suddenly get crazy healthcare diagnosis. And then that makes them not trust your healthcare system, which is the people they should be coming to if they do have a problem. So the hallucination problem is definitely a big reason why we have issues with rolling out LLMs in healthcare space. The other is simply the restrictions that we have around data in the first place. Everybody's heard of things like HIPAA. HIPAA data is the government frameworks around how your data is controlled and how it has to be controlled. There's even a stricter version called FISMA, which is very, very, very tightly controlled. We have both kind of things at work. And because of that, you can't just say, hey, I'm going to take healthcare data and upload it to ChatGPT to ask questions, because the healthcare data can't leave your network. And I mean, it's not just maybe it can, maybe it can't. It cannot leave the network. Mm-hmm. Or there are multiple legal penalties. There's all sorts of craziness that would happen. So healthcare data does not leave. Wow. And that's why now when we're looking at doing stuff for AI in healthcare, we're looking at bringing models in and doing all the data analysis work on site. And of course, if you're looking at doing something like that, you're probably going to want to retrain your AI depending on what data sets you're actually using or depending on the things you find out. So at that point, you're looking at retraining your AI on site. And that's where it starts to become a good idea to look at actually bringing the hardware on site and saying, hey, let's sort our hardware, let's put our hardware next to where we already have terabytes of data that we want to go through anyway, so that we can train things as we want to, we can fine tune things as we want to, and we can try different models and check the outputs on things as they run.
Do you think that solves hallucinations a little bit, or
not a chance? So yeah, I talked to you guys about this before we went out to pizza and stuff. There's for everybody else on stream and podcast stuff. There's a wonderful talk that was done at DEF CON last year by a guy named Craig Martell. I absolutely recommend everybody interested in AI check it out. It's fantastic. He is the head of AI and machine learning for the Department of Defense. So all the military reports up to the DoD. And he talks about the hallucination problem. And he talks about the real problem that we have with the hallucination problem is we can't predict how much an AI is going to hallucinate. It might hallucinate 20% one day. It might hallucinate 90% one day. You have no idea the ratio of truth to hallucinations you're going to get. And that becomes a huge problem because you can't rely on the trustworthiness of the data coming out. If it was even right 70% of the time, that would be great. We could, in that point, maybe run 10 different AIs, knowing each one's going to give you a 70% right answer, check to see how many of them have the right answer, and then we could assume that most of those have the right answer. Mm-hmm. But we can't even do that. And that becomes a problem. And the fact that you can lead AIs into, I would say, deliberately giving you a bad answer by just how you phrase the questions.
Yeah, true.
My example for people frequently is if you give an AI something like a copy of a medical chart where there's nothing wrong, the person's completely healthy, and ask what's wrong with this person, it's going to give you an answer of something's wrong because that's the statistical answer that it thinks you want.
Mm-hmm. Why does this person have cancer?
yeah, and it will come up with something. It will make up something, just like last year when they had the lawyers out of New York that put the thing out that says, write a case file for this, and it just made up cases. And I said, here you go.
Yeah, I think you raised a great point. Something our founder here at Consonant Scale, Justin, says is he believes that, AGI won't happen through LLMs, and we'll have him on coming episodes to talk more about that. But I'm curious your thoughts on, do you have any thoughts there?
Yeah, so
please share.
I've talked about this with a couple other people before. It's like LLMs do have some really great things that they do. And I think that part of the hype that they get is because there are things good things that they do, and they're not what really a lot of us in the tech field were expecting. Like we would have expected in the next big AI revolution to be like a better version of machine learning. We certainly didn't expect creativity.
Yeah, true.
Like we did not expect AI to be like, hey, we can do art. We can create music. We can do all this stuff. That was absolutely out of left field. And I'm not sure if LLMs will be essentially what turns into that sort of AGI concept, or if LLMs will be a good stepping stone for what gets us there. Because we may need that creativity in the LLMs to help us develop what comes next.
I'm very much a proponent that literally everything can be made to the base level of be language. And that's what an LLM, it's a language model. And that descriptors and tagging is really important when it comes to AIs and stuff like that. So whether or not that can achieve AGI, it depends on the definition of AGI. If we're talking about sentience, that's obviously a no. highly doubtful that LLMs even have anything to do with sentience. It's just neural nets and how those perform and function, and that's something completely different. So whether or not that's attached to an LLM is like, to me, doesn't really mean anything. It's like, what is the technology behind the LLM? What is it actually pulling from, and how does that determine like the hierarchy of relations? And if we can understand how that works and manipulate that, besides focusing on the LLM, I think that we have a truer understanding of what it would take to have AGI. Which to me, AGI is just the general knowledge of output from any given model is equivalent or superior to human intelligence. And when you start getting into actions, so before this episode, we were talking about AGI having a component of actions. To me, that's something, a different terminology altogether, because that's more than what the actual acronym describes. It's artificial general intelligence. And so if we had like AAGI, where it's like action artificial general intelligence, something like that, I think that would be a better descriptor. But I think that there's a lot of co-opting in the space where people are like trying to say AGI is all these things and it has to be all these things. Like, no, not really.
Yeah, and we may need new terms for all of this, since we're taking this in multiple steps to get where we want to go, which is that whole AGI concept. It's like, do we need new terms to define where we are, what the next steps are, where we're going? It's like I was saying right before the meeting, the podcast started. Personally, one of my sort of stepping stones in looking at AGI stuff is something that will, to define AGI to me, and like I said, this is just me, something that will take action on its own. If something can't take action on its own, then it's not independent enough to be essentially an intelligence. It's just a responsive system. And right now, it's like no matter how well an LLM works, it doesn't do anything till you type in a prompt and hit enter. Mm-hmm. And it's not going to come back later on and go, oh, hey, I was thinking about it, and maybe you want this too, or something.
I used to think that too, that AGI was synonymous to autonomous work. But the more I studied the space and this idea of like agentic and AI agents coming out and what autonomous work is, I think AGI, the best and the truest sense that I can find in definition, is an actual general intelligence, artificially done, that mimics or equals a human in all areas. And then from there, we can plug and play the agents, the autonomous work aspects.
And I will say, for my bar there of autonomous activity, I mean, that could be faked really creatively by somebody by rerunning tasks at a timer in the background.
Right. Oh, yeah,
so it is that sort of thing of even if it looks like it is doing that, there's still a lot of investigation we'd have to see before we could say something's actually intelligent and doing something on its own.
Yes.
Right.
There's a lot of hype, but not a lot of actual innovation in AGI.
We're seeing that a lot in robotics right now too. AI and robotics, where it's like some of it will have like, oh, the robot's actually moving on its own, and it's kind of like agentic in a way. But you see these people wearing like the actual like goggles, glasses, the gloves, and like moving in the background. You're like, oh, so it's not really doing that. It's not like processing. There are some like the Tesla Optima.
Yep, Optimus. Tesla
robot.
bot.
Yeah, that seems to have its own independent function. But
should we talk about the Nvidia chip that Mike said was delivered to his place of work? This is really fascinating.
Yeah, so we're speaking back of the stuff that we're doing at work. We got some of the Grace Hopper chips in, which is one of NVIDIA's newer AI systems. It's the CPU GPU combo. I think it's like GH200 is the number for it in NVIDIA, and we're setting up a system with it right now. So we will see how well that runs for us. But
what is the cost of something like that?
I honestly don't know. It came down as a project from someone up above that said, I want to do this. And somebody said, okay, make it happen. I'm like, all right.
Well, when you hear those three words, make it happen, usually a big budget attached to that, especially with the NVIDIA chip delivery.
Yeah, but I mean, NVIDIA isn't a stranger to the healthcare space either. We actually had a meeting 6 months ago, I think, with NVIDIA directly. And they were saying that they were already working with several of the hospitals where they would custom train LLMs for the hospitals and then deliver the LLMs to the hospital specifically saying you get the LLM, all the rights for it and all the rights for everything that it does for you. And that made us suddenly go, okay, we need to listen. Because it's not somebody that's going, we'll give you the LLM, but we're keeping all of the stuff on the back end. They're like, no, you pay us, you get the whole thing.
Wow.
And I was like, wow, that's not a bad deal.
So it wouldn't be an LLM a consumer could ever use. Like it is gated to that healthcare. And
It's
that
gated to,
healthcare only,
yeah. It's
that
basically,
brand.
it's custom trained on exactly what we want on our data or a combination of our data and publicly available. It's like you set up however you really want it, Nvidia will build it for you.
Wow.
Nvidia is really innovating right now. I can't believe that they're even doing that. Like that like detailed, tailored manner of like approaching hospitals is very fascinating to me. Because the way I picture Nvidia is just like, oh, we make graphics cards. And we make
That's how they started.
We make the devices and we just sell them to you.
Yep.
It's like, no, they are so much more. They have labs. They have training models that they're running in the background that are simulations of real life, and they're training robots to do all sorts of stuff. It's crazy.
They just surpassed Microsoft today.
Yep.
I heard for
Yep.
market cap and AI. They're the most valuable company.
Yeah,
Crazy.
I missed the boat on that.
Didn't invest
investment.
in those stocks?
No.
Dang it, Jeff. Me neither.
Still time. I'm
Today.
not sure the Nvidia thing is going to drop. I mean,
Yeah.
they've got the AI thing is still going to go for a while, I think.
I need to sell my house in Texas.
I'm waiting for the moment we have really good like human brain chips. I don't know if you saw that people are designing chips that are modeled like actually like they have the biological chips.
Insane.
They burn out very quickly, but people are designing them. I'm like, once that comes about, if it processes like equivalent to a brain with the power efficiency the same, I might invest in that. That'd be pretty interesting.
I've seen similar ideas, but it's been quite a while. There used to be an idea a long time ago about storing data organically and writing data just to an organic sequence, and the idea that you could keep your data that way. And that was one of the crazy ways people were trying to do long-term data storage and stuff.
Yeah, people are literally growing brains right now to try to
Yeah.
create chips. And it's weird. It's kind of creepy too, but it's
Yes.
fascinating.
And across countries, it's really interesting, right? Because China has no moral. I think the Western world has some moral restraint, but China's like, no, let's actually take DNA from all the intelligent people in China, put it in a lab, and create new infants. That's happening, and then modify it with AI.
I think the guy that did that did get in trouble in China. I don't think but there was a guy that did that.
There is a fantastic episode on Y-Files. I don't know if you've ever seen that talks about that.
Yes, I watched that. It's very good. What was
Yeah.
the name of that project in China?
I know that the technology they used, I believe it was CRISPR.
Yes, CRISPR. That was
CRISPR was the technology they used.
crazy.
Yeah, that's a rabbit hole to go down for
Absolutely.
sure.
Very much so.
Absolutely.
So when it comes to, I want to talk about upskilling a little bit.
Okay.
We have a lot of people that are in traditional jobs at the moment that the advent of AI coming about and everything that's happening, that will need guidance when it comes to upskilling. You're somebody that have a long tenure in your career. So when it comes to like that process of upskilling and getting used to AI, what are your thoughts there, and what would you recommend for somebody that's brand new, regardless of the field they're in?
Brand new, I definitely I recommend getting into a bunch of the AI stuff. I think it's coming in a lot of fields. I think that it is going to be used in a ton of different ways. For the more experienced crowd, I know those are the ones that are more worried about like, oh, AI is going to take my job. And I don't really see it, at least not in how I'm working or the people that I'm working around, because I'm looping back to kind of the beginning because of the hallucination problem. There was a study done recently where they said more than 50% of the code that AI would write when given a question of writing code for a job, more than 50% of it was wrong. So there is a skill level that I think people need in dealing with AI to be able to go through what the AI gives you and find out, is it real in the first place? If not, where is it broken? Do you need the AI to start from the ground up and regenerate it? Or can you fix what the broken part is? And even if you're having an AI generate code and it generates the code perfectly, how do you take what it made and integrate that into your system? Because anywhere where you have a large code base, you have your own variables for stuff. You have your own loops of code for how things run. Where does that need to be inserted in the mix? Does it, what service accounts are you using for authorization? Does that need to actually be entered in for how it runs things? Do the variables that it's using match anything you're using now, or are they different? There's an awful lot of things that have to be figured out if you're just basically taking what the AI gives you. And even on the network space, you have, if you're going to say, hey, write new code for changing VLANs on a Cisco switch. It's like, okay, it'll give you something. Are you really going to take what it gives you without really understanding it and upload that to production hardware and hit go? Because you could crash the entire environment and everything it's connected to. Because the whole switch could go offline if it's wrong. It's things like that. And so I think that for the new people coming in that are the techies, yes, it absolutely matters to look at the AI, and see what it can do for them. But I think some of the skill set will be taking what the AI gives you and figuring out, is it any good in the first place? And how do you integrate that into an already existing stack of whether it's software, process, procedures?
Something to think about. I think that you shed a great light, especially coming from the healthcare industry, where you're seeing firsthand hallucinations. Like, we can't have that at all in this industry. It affects people's lives.
Yep.
And so, like, that's a very real perspective versus, like, a lot of the headlines you see on an average day in AI news. Oh, it's a game changer for the healthcare industry. Well, there's some real roadblocks, and you see them. But then when we think to the future and the next, like, even just 6 months, this spring we had 4.0 released. We saw Apple integrate with ChatGPT, bring that into their products, launching this fall. We just saw, and then we saw, of course, Google had an hour and a half launch for so many things, from AlphaFold and figuring out the structure of life and proteins. And that's a huge breakthrough. And it's just like, what will the next 6 months hold? Do you think that there's a possibility that there's a timeline on the solving of the problem of hallucinations? Do you think that AI can iterate on itself and come to a point where the person is doing less of the work, there's less of a requirement for that skill gap, and AI gets there? Or do you think we have more time?
I don't know if there's a timeline for it, but I think that there's definitely steps for adoption that are going to require that. Like you're saying, from what I said before in the healthcare space, for what we're doing, it's going to require that. It's going to require at least a knowledge of how much you can expect a failure rate and how much hallucination you can get. There are other areas in the healthcare space where the creativity matters far more. Back for what I was talking about on the AI4 conference last year, and most of their videos are available on YouTube as well. They had some stuff on using AI for discovering new drugs in the pharmaceutical space, and that had some fascinating new ideas for what they were doing. They were basically figuring out how the different molecular bonds happen with the drug, basically in the drugs or between the proteins, and they would take a picture of that, cut out parts of the picture, and then give it to the AI and saying, what belongs in the holes? Sometimes it'll put something that was just there. Sometimes it'll put something new. And then they go, holy crap, think of that. Does it really work? Does it fit that way? Let's try to make it. And there was a talk given there by an organization where they had a automated system that would take whatever the AI gave it and just try to make it immediately and see, can we come up with brand new things that literally have never existed before that might be, the next super drug. And for that, it doesn't matter if the AI hallucinates much, because it costs them probably not more than a couple of bucks to try to create something in the first place. If the very creation of it fails and it goes, nope, that just won't exist, then it's like, okay, try the next one.
Yeah.
And it just becomes a machine of attempting to try things again and again and again. And in that, the current models do work really well. But when you get into things like patient data, you need to be right. And I think that in some ways, when you're dealing with the LLMs these days, it's kind of like, who is it okay or not okay to hallucinate to? Because if it is, if it's like the pharmaceutical company and it simply means a failure of a process and that's it, and they go on to the next one, that's fine. If it's a patient and they're getting bad medical data, it's not fine. But at the same time, if you could do something that would be reviewed by a doctor or a nurse before it gets to the patient, then it becomes more acceptable, because then it could be caught before something stupid gets to a patient. So it becomes a question of who's handling the hallucinations in the process, and do they understand what a hallucination is in the first place?
Great points.
When you first mentioned that, my first thought was humans hallucinate all the time. And error rates between humans is like, it's an issue in healthcare in every single industry.
Yep. Failure rates exist, period.
Even if you're a lawyer. But the one thing that is the caveat to that is that we don't know, predictably, the AI failure rate.
Right. And humans, we have a better job of training failure rates out of.
Right.
We have policies, we have procedures, we have training, we have all sorts of stuff that says you do these steps in order to minimize any sort of an error. An AI, it's like, we don't know if you're going to get an error or not. Here you go.
Yeah.
We can't control it, and we can't work around it, and we can't put another AI behind it to catch an error, because it may not answer right either. Mm-hmm. And that becomes the problem. Is we can't statistically figure out what coming out of it is truth and what isn't.
That's interesting. I saw a number in a book I was reading the other day, I think The Rise of the Robots, talking about healthcare. And it was billions of dollars are accounted for every year due to medical errors by people in the healthcare industry. So to your point, Jeff, it's a fair point. Humans hallucinate too. But to your point, AI, we don't know when that answer is going to be vastly incorrect. And so the creation of the need to fact check almost creates more work.
There was back at the AI4 last year, there was a presentation given by a group, and I don't remember which hospital group it was, which was using a combination of AI and machine learning in operating rooms with cameras mounted up above in the ceiling. And the idea was to be able to track specifically sponges, but also other consumables being used in an operation to make sure that they got all of them out.
Oh.
And it's that sort of thing. If you actually do, you start to need that AI and machine learning thing, because obviously anything that's going to come out has been used and is not going to be in the same shape when it came in, and every single thing that comes out is going to be shaped differently. So how do you start counting all of these? And it was a system to be able to do that, to fact check behind things. And that's that sort of thing that, even with people, we do want automated systems to come through behind, if we can, to say, hey, we're going to double check this. But even in that, your output, in case of a hallucination, if it's an AI system, is going to go to the operating team that's going to say, hey, double check your number of sponges before you're done. Mm-hmm. It's not something that's going to go outside to other people. It's just going to say, hey, I've got 20 here on the table. You said you used 22. Double check and make sure 2 aren't stuck together.
Yeah. In a perfect world, let's say all hallucinations are fixed, and that's no longer a problem in AI. How would that affect the healthcare industry?
It would do a lot. It really would. I mean, we could do things like anything from giving people automatic second opinions to deep learning and analysis of mountains of medical data to actually looking at very complex questions in healthcare. We do start to look at things like, it's not just whether one person might be more prone to a particular type of cancer or one family might be prone to a particular type of cancer. There are bigger questions when you start looking at a larger scope of saying, okay, comparing this county to this county in the same state, what are the medical problems? Which ones match, which ones don't? Which ones have unusual amounts of something compared to another county? And then you start looking at whys. And if you can start dialing in real answers for some of that, that's when you can start trying to look for real, honest problems and where things are coming from.
Wow.
And that's when you're getting into deep medical data analysis. There are some systems out there that can do some of that, but there's nothing that's as good as coordinating a lot of that together as an LLM would be.
You think about like doctors. Like I've seen some doctors when my kid I brought her in. I thought she had measles. The doctor went out and actually consulted a textbook. Some doctors, like I've heard from friends, go out and consult Google. This might have a higher rate of accuracy if this problem was solved.
Yeah.
Hallucinations.
Yeah, I mean,
It's crazy to think about.
You could literally have a second opinion generated while you're still in the room with the doctor.
Yeah.
The doctor could have a council of separate LLMs that he could type in stuff and it would answer back immediately. There's a lot of things that we could do. And with, like I said, with that sort of deep learning, there's a lot of things we could do about forecasting that says like, hey, your blood work is showing these things. So for you personally, in 20 years' time, what's that going to look like if we don't do X, Y, and Z? There's a lot we could do if we could eliminate that sort of hallucination problem.
Crazy to think about that.
Efficiency goes crazy there too.
Oh, yeah.
Because if one of the things is kind of going back towards upskilling is that job displacement is something that is important. And the reason why it's important to say job displacement as opposed to like complete careers disappearing or fields is that AI is good at one thing particular, and that is compression of time, the amount of time that it takes you to actually do something, and that breeds efficiencies in every single workplace. And so you need less people to do the same job, but you still need those people to check accuracy. But especially in the medical field, from my understanding, like doctors being able to have complete diagnosis of like everything that's happened to you in your life is so revolutionary. Then not only that, like you were talking about with entire family histories, like looking for correlations is something that AI is really, really good at. My first wow experience with ChatGPT was when Open Interpreter came out. And I literally uploaded data and I said, what is everything interesting? I don't even know what I'm looking at. I don't know what's cool about it. I don't know what I can do with this data. What can I do with it? And just asking that question, it had so much knowledge and insight into it and found correlations that I wouldn't have thought of. And that's one of the most amazing things that LLMs in particular can do. And so empowering a doctor with that would be incredible.
Yeah, and the data analysis point can't be understated because you could use, like, one of the discussions that's happened around the possibility of LLMs would be they do a decent job of speech to text. You can talk to something and it writes out the text. Using something like that in a hospital setting so that the nurses, as they go around their rounds and they talk to all the patients, it records exactly what all the patients say. And then you could take that data and automatically link it to their chart. How are you feeling today? What's going on? What hurts? What doesn't? Does anything feel better? Does anything feel worse? If you automatically update that to their chart is good. They can make notes. Nurses do take notes. Nurses do update charts. That's fine. That's great. That's what sort of thing we want. But then you could take that data and immediately start referencing it across any number of factors. Other people in the hospital, family members, other people that have the same condition, other people that have 3/4 of the same symptoms, but not all of them. And suddenly your ability to do data analysis on medical stuff in a large scale just explodes. It's not just one person in the hospital and notes on their chart. It's everything interconnected.
Yeah. I was reading about this in Age of AI by Eric Schmidt, and he was talking about the Moderna vaccine and how we had basically years of progress in a vaccine in 2020 that should have taken like 20 years. And that was because of AI doing all the data analysis and just spearheading points of reference that we would never have been able to do humanly.
And the mountains and mountains of data that we had leading up to there already.
Yeah.
And yeah.
Yeah, so that's pretty fascinating. Well, is this a good place to wrap up with Mike? Any other thoughts you would like to share while you're here?
Nothing I can think of right now. I'm sure I'll have more after I leave, but that's the way it goes.
We'll have to have you back on for that.
Yes, we'd love to have you
Absolutely.
back. Yes, this was super insightful.
Yeah, it's awesome. One of the, I didn't want to go to last week to the event. I was like, I don't really feel like
He's
going.
confessing.
Yeah, I am. And then we had that conversation with you, and I was like, it was worth it just for that
I
conversation.
had a friend that I went to the event the week before, but not the AI event. I had a friend that went to the AI event before that, and he was like, "Yeah, it's nothing big. It's just a bunch of people talking about like what they typed into Chat GPT." And I was like, "Yeah, I'll go anyway. I'll check it out." And then I ran into you guys. I was like, "Okay, this is cool."
Now you're on a podcast in a
Yep.
studio.
It's because it's fun.
It's good to nerd out with people.
Yes, it really is. And for us, like we work in AI full time, and it's great to speculate, read that news headlines, we break those down, but it's also great to have real people on the inside of industries that are seeing these chips get shipped in to work on new custom models for what they do. So we really appreciate you being open to share about this.
Sure.
And your work.
Happy to. Be glad to come back.
Awesome. Well, that was Mike Stone, ladies and gentlemen.
Awesome. All right, we'll see you guys next time.
That's a wrap.